This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
It can attack out of nowhere and without warning. Tagged as one of the most common chronic brain disorders in the world, epilepsy is a medical condition caused by sudden, brief changes in the brain.
There are many types of seizures. The most common that people know is the motor seizures, when they're convulsing, the eyes are rolling up, and they can pee in their pants and all that.
Just like Apple Taytay, an epilepsy exemplar awardee who fought her way back to a rewarding life. Apple, who was diagnosed at the age of 2, experienced grand mal seizures until high school. This was marked by violent muscle contractions and frequent loss of consciousness.
As a child, it's very hard. I cannot play outside because the seizures might come because it's very unpredictable. Most of the time, it's twice, thrice a day. It happens that way, 5 times a day. There are certain movements that when a person looks at me, oh, weird, what's happening to you? Maybe you're possessed.
When you have seizures, you're not functioning. Your brain is not functioning. Yeah, so for children, they have a very hard time in school. And from adults, their daily life is interrupted significantly by seizures.
When she went to college, epilepsy continued to affect her life even as she was given extra attention and care by her parents and teachers. That is why for Apple, aside from continuous therapy and medication, a proper understanding of epilepsy is key to dealing with this problem.
I felt that I'm very loved there and tinanggap ako ng mga tao. The people there accepted me kahit na everyday akong nangingisa sa harapan nila. And that's the start of coping up.
What can trigger seizures? What should you do when you or someone you know experiences a seizure? What treatments and medications are available to those dealing with epilepsy? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Martesio Perez, neurologist from the Makati Medical Center. Also with us is Dr. Estrella Ilustre, child neurologist from the St. Luke's Medical Center. Good evening, doctors. Welcome to the show. It's National Epilepsy Awareness Month, and in keeping up with this theme, we'd like to learn more about this medical condition. So, doctors, what is epilepsy? Let's start with Dr. Ilustre.
It is actually, it results from an abnormal electrical activity of the brain. It results in abnormal contraction of the muscles or even like impairs consciousness, sort like that.
Okay. Dr. Perez?
Well, it is a recurrent, spontaneous problem affecting the brain. And it depends upon what part of the brain is affected, so that there could be motor manifestations or there could be psychological manifestations or mental manifestations like absence, where you don't know what's going on for a brief period of time.
Okay. And in reference to the case study, Apple, she was diagnosed with this medical condition when she was just 2 years old. So Dr. Ilustre, as a child neurologist, it can be detected pala early on, as an infant, as a toddler.
Oh yes, it can occur any time. Seizures can occur at any age, from the neonates up to adulthood. So wala siyang pinipili.
wala siyang pinipiling age and
sex,
status in life,
Yeah.
wala siyang pinipili. And we talk about seizures. Does having a seizure automatically mean that you have epilepsy?
Are you asking me?
Yes, doctor.
No,
Go
no,
ahead.
no.
Yes, please.
No. A seizure can be caused by just a drug or withdrawal of alcohol, and that doesn't mean necessarily epilepsy. Epilepsy has to be a spontaneous, recurrent seizure. So that if you are subject, to example, for certain drugs or subject to certain circumstances and you have a seizure and it occurs only once, then it's not epilepsy.
Okay. So if it's not epilepsy, then maybe this person or this individual is just
It was just a convulsion.
tired
yes,
or maybe puyat, like what we say, no? Sometimes nakaka-apekto rin yun because this is a condition which affects the brain. How about Dr. Ilustre, in children, can you please help us understand this medical condition in children?
Okay, there are many types of seizures actually. The most common or actually recognizable type of seizures is the generalized type of seizures, wherein the patient has generalized contraction of the muscles, and then the patient loses consciousness.
Okay.
But there are other types of seizures among children, like if there's an impairment of consciousness, or like in absent seizures among toddlers or school-age children. They just stare blankly during in school. So it's actually difficult to detect unless the teacher is really, very, familiar with this disease condition.
You mentioned difficult to detect. So what are the telltale signs that one is having a seizure if there are some signs and symptoms that you cannot detect?
Okay. In school-age children, if they are not performing well in school, if the teacher observes that the patient is having blank stares during daytime, it actually occurs several times in a day or even 100 times in a day. So you suspect absent seizures because these are just subtle types of seizures.
How about in adults, Dr. Perez? Is this the same
Usually this
manifestation?
is, the absent seizures usually start in childhood and go up to adulthood. But towards adulthood, as they grow, there are less manifestations of this, no? But there are other kinds of seizures which are more complex, affecting the frontal or temporal lobe, in which this could cause manifestations, behavioral changes,
Okay.
which are inappropriate times. Like, for example, if there is a solemn flag ceremony and someone starts dressing and undressing in front of everybody, this is a complex type of seizure. So you have to be aware of these possibilities, and you have to be able to, if you are aware, you have to be able to diagnose it. Because many people go through life without knowing that they have this kind of seizure, and others think that they are queer.
Yes.
But actually, it is a behavioral manifestation which is transient, and then it disappears after a while.
Other people think that when one is suffering from an attack, that they're weird, or that they're the common
Possessed.
Yes, possessed, or that they might it might be contagious. That if they go someone who's having a seizure and try to help that individual, they might get mahawa sila. They might get contaminated. Why this thinking? Why do people think this of those who have epileptic attacks?
Because throughout the ages, people who have epilepsy have certain manifestations that can be quite weird, no? They have hallucinations, or they have delusions and abnormal behaviors. So that at one time before, it was thought that people with epilepsy had been possessed by the devil. And because they have quite bizarre behavioral patterns. So,
but now in the 20th century, no, do people still think that, or they have moved on and actually try to understand this medical condition?
well, that is why we have this Epilepsy Awareness Week, which we started several years ago, because a lot of people are still ignorant about epilepsy, and we want to make the general population aware of this problem, because as a result of epilepsy, sometimes you have biases against that, and to the point that sometimes you cannot even find a job, or if you are working, you are fired from your job because of ignorance of the employer about this condition.
Is it true that you mentioned that others are fired from their job because of this?
Oh yes, you can get fired.
How can we educate our viewers out there, everyone out there, that this condition can be controlled?
That is exactly what we want to do, no? To disseminate knowledge about epilepsy, and that it is just a transient thing, and people could have a normal life, live a normal life, and have a normal intelligence. And yet there are times when if they are stressed, and sometimes if they omit their medications, they can have attacks, no? So this is the prejudice against people with epilepsy. That's why it's very difficult for people with epilepsy to find a job or even keep a job, because the moment that they are known to be having epilepsy, they are fired or they are not employed.
We'll get to understand, and I'll ask you more, doctors, about this medical condition, the triggers. What are the triggers or the factors that can contribute to having a seizure or an attack? But first, we will answer a question from Facebook. This question comes from Antonio Tolentino. Doctors, he asks, if the person has epilepsy, will he or she be carrying it as he or she grows older until the last days of this individual's life? Dr. Perez?
Well, some epilepsies are partly genetic, so that this tendency to develop seizures may be with you for the rest of your life. And depending upon the situations that you are facing, you may develop a seizure. Lack of sleep, stress, or anything that low blood sugar could also provoke a seizure, or some drugs could provoke a seizure. Sometimes these anti-TB drugs can cause a seizure. No? So a lot of things can provoke a seizure.
Okay, and the Twitter question, the Facebook question was do you carry it for the rest of your life? Does it, Dr. Ilustre, does it get better with age, so to speak?
Well, in children, there are seizures that are specific for the neonates. Well, it depends per age group. We classified. There are seizures that are specific for a certain group of children. So, but if it is secondary to genetics or other metabolic abnormalities, it is actually a lifelong condition.
Okay, but it is treatable. There are medications which we will be talking about a little later on. But first, we can go to our another Facebook question, doctors, from Michael Angelo Manalo. If one drug used to treat epilepsy fails, can they use another anticonvulsant? Dr. Ilustre?
Definitely, yes. You have actually there are anticonvulsants that are specific for a certain type of seizures. So we have to classify the type of seizures this patient is having, so we can give the right medication.
Okay, so this patient, Dr. Perez, would you like to add to that?
Well, as a rule, most people with epilepsy do not have such a hard time, no? In 70%. But in 30%, they may need prolonged treatment and even multi-drug treatment. In which case, if you already are undergoing multi-drug treatment, there is also a greater chance of side effects, cognitive impairment, and some other effects even on the offspring or on the children. No? So you have to be very careful about giving these drugs. But there are drugs, especially the new drugs, have much less side effects than the old ones, no? The old drugs like phenobarbital, which is the cheapest, can cause a lot of cognitive impairment, and especially in children, I think
Hyperactivity.
it has the opposite effect. Instead of being sedative, it causes
They're very hyperactive.
hyperactivity.
Doctors, we will talk more about epilepsy, its treatment, and first aid when MedTalk returns.
Did you know that in Tanzania and other parts of Africa, from the early times up until today, epilepsy is still considered the work of the devil, a product of witchcraft and even believed to be contagious? This lack of proper information is one of the main reasons why epileptic patients around the world still suffer from discrimination. Thus, a campaign to raise public awareness of epilepsy is encouraged.
We're back here on MedTalk, still talking about epilepsy. Doctors, I understand that epilepsy is more common in third world countries. Why is this? Dr. Perez?
Well, in third world countries, you have more infections, malnutrition, trauma, and a lot of other factors. No? In our country, for example, schistosoma is quite prevalent in certain areas, like in Leyte and in Bicol. So if you are from that place, you may be prone to develop seizures because of the deposition of these parasitic eggs in your brain.
So where do you get these parasitic eggs in your brain, Dr. Ilustre?
Actually, that's more common in adults who are working in the field.
Okay.
Okay. In children, meningitis is also common as cause of seizures among children. Encephalitis, it's actually an infection of the brain parenchyma. Okay, the meningitis is secondary to, lack of immunization against common causes of meningitis among children. Encephalitis is actually secondary to a bite of mosquito, or like an organism that stays actually in your nostril, but it travels through the nerve and it reaches the brain, and then it causes infection. One of the most common causes of infection in the brain here in the Philippines is tuberculous meningitis. We still have a lot of tuberculous meningitis in children.
Which does lead or can lead to
seizures.
To a seizure.
Yes.
Oh, to a seizure, rather, yes.
Oh, yeah.
So now, doctors, we've talked about the triggers, factors, differentiating the seizures and the cause. You know, there's so much to learn about epilepsy, and then, you know, we're trying our best to squeeze it into this discussion. But now let's move into first aid. When it comes to someone who's having an attack. Let's say this individual is having a seizure at home. How do we help this person?
Okay, first of all, you have to avoid aspiration. So you put the patient or lay the patient on the bed and then turn him to one side. It's either on the left or right, just to avoid aspiration of the saliva. And then loosen the clothing, just to ensure airway breathing. Okay. Do not put anything hard in the mouth because it might break a tooth and cause aspiration.
Okay, you mentioned do not put anything hard in the mouth. I remember hearing that you must put a spoon inside the mouth when someone is having a seizure. Does this still hold true?
No, you should not put anything hard in the mouth because before parents would put spoon in the mouth because they have this belief that the child might cut the tongue during an episode of seizures, but that's not true.
Okay. Nothing hard in the mouth. Lay the child or the adult on his side so that the saliva can come out.
Yes.
Okay, this is at home. What if you are outside, like our VTR earlier, you know, you're walking in the street and someone just falls down and yun pala is already having a seizure? Doc Perez, what should we do? How should we help?
As you mentioned, the most important thing that happens is an impairment in your oxygen exchange. So aspiration of your saliva and other things is an important factor. So as soon as this happens, you have to keep a person lying down, turn to one side so that the secretions, saliva will drool out instead of going inside the lungs. And also, you should keep that person away from sharp objects and objects that could cause damage. No?
Okay.
Now, this practice of putting a spoon in your tongue, or it used to be that way before, because usually the tongue gets bitten and you develop a wound in the tongue. No, but people have found out that putting something hard like a spoon or in the mouth will actually cause more damage than not putting anything. Okay. So I think the most important thing to remember when doing first aid is that this patient should be able to keep his respiratory system free so that there will be no obstruction to the exchange of oxygen from the outside. And also, this patient should not be hurt by the presence of objects that could hurt him during these uncontrollable motor activities.
Okay, so we've talked about first aid. Now let's move into the treatment and possible medication. So once one has been diagnosed, what are the different types of treatments and medications that he or she should be on?
Okay, there are pharmacologic treatments that are given to these patients. We have the new drugs and then we have the old drugs. In the Philippines, because of cost effectiveness, we have the very old drug which is very effective, the phenobarbital, and it's very, very cheap also. Well, for our patients who cannot afford, syempre, the new generation anticonvulsants, we give the old drug. This is the phenobarbital. They are phenobarbital is very effective in controlling seizures, but it has this side effect. Instead of these patients going into sleep, the patient becomes hyperactive.
This was what you were mentioning earlier. That happens to children.
Yes, in children, it's a paradoxic. It has a paradoxic effect in children.
Okay. And once the child is on this medication, and once the child has been diagnosed with epilepsy, does he or she take it for life?
No. Well, it depends on the etiology. When it is idiopathic, that means you don't know the cause of the seizures. We usually give it for 2 to 3 years. Okay. And the patient should not omit any dose of the medication, because if they omit even 1 dose of medication, the blood level of this medicine goes down and the patient goes into seizures.
Okay.
And then you're back to square one. You're back to 0 again. You have to count 2 to 3 years again before contemplating and removing the medicine.
Okay. This is for the children. How about for the adults, doctor? Let's talk about the complex partial seizure that happens to the adults.
Before we talk about that, I'd like to add more about phenobarbital. No? That is the oldest and most reliable drug. Unfortunately, this drug also causes cognitive impairment. So as much as possible, ideally in Europe or even in the United States, they no longer use this drug for seizures. But in our country, it's the cheapest. Unfortunately, in many places of the Philippines, this drug is not available because of so many restrictions by the government. No? You have to have a prescription by the doctor, and you have to have specific forms, and these patients spend more from seeing the doctor than just buying the drugs. No?
So how does one get a hold of similar type of medication if this is not available?
Well, this is the drug that is the cheapest and the most practical. But the newer drugs are, of course, much better to use. But then they are also very expensive. And you know, in many of these patients, epilepsy is a lifetime problem. So you have to think about the daily expenses, which can even be more than their bare needs for food and nutrition.
Yes.
So this is quite a problem, and many times the government and private individuals have to help.
So hence our National Epilepsy Awareness Month,
Yes.
to disseminate information and again to create awareness for everyone out there who may be suffering from this medical condition or may have a family member who's suffering from this condition. How about your tips, doctors, for, I mentioned family members, your tips for family members who might have someone in their family who has epilepsy?
Well, it depends on the, okay, I use the word severity of the seizures and associated medical problems, other problems associated with seizures in these children. Okay, well, patients with epilepsy can live a normal life actually, so you treat them as normal individuals, and then well, make sure that when the patient is taking anticonvulsant therapy, they make sure that there must be an adequate supply or no omission of medicine.
Which is taken on a daily,
taken on a regular
basis.
Okay. So they should also know the triggers so they can avoid the triggers.
Okay.
They can avoid seizures. I think that's all.
You mentioned this in children. Does this, I assume it's also applicable to adults, Dr. Perez?
Well, in adults, usually, in most patients, in 70% of the patients, they're all right. They can be on drugs for a year or two, and then this could be stopped, and they're all right, no? But in 30% of the patients, they may need continuous treatment with one or even two drugs or even surgery because of the difficulty of controlling the condition.
Okay.
So it's quite, you know, I think in our country, we still need epilepsy centers so that the physicians, because even doctors are not very familiar with these conditions.
Well, tonight, doctors, you have given us some knowledge about how to understand this medical condition. So we'd like to thank you for coming on the show, and possibly we can have you again soon to talk more about epilepsy and get to understand it extensively. Thank you once again, Dr. Perez, and thank you once again, Dr. Ilustre. Thank you again to our doctors for enlightening us about tonight's topics. See you again next Tuesday on your scheduled on-air consultation here on the Solar News Channel. See you next Tuesday, 10 p.m. This is Angel Jacob. Good night.